What's the difference between surveillance and screening? Surveillance recommended at each preventive care visit. Always inquire about parental concerns, and this identifies children who have or who are at potential risk for developmental delay. So what are risk factors for developmental and behavioral problems? Prenatal exposures, birth complications, and perinatal infections. All of these increase the risk of developmental delay. Other risk factors: a chronic underlying medical condition, a genetic condition, a toxin exposure, or worrisome home environments, such as children growing up in poverty, in food insecurity, or if there are parental mental health problems. Why are these important to know for your test? They're important because their presence would indicate that close observation and watchful waiting is not the correct answer, but rather referral is the correct answer. Now, surveillance is different than screening. Why screen in addition to surveillance? Surveillance alone may miss children with developmental and behavioral problems that are either asymptomatic or have gone unrecognized. Examples of screening tools that the AAP recommends are listed here for younger children and are listed here for older children. The AAP does not make a recommendation for one of these screening tools over the other.